Perform hand hygiene, and now we're ready to don our sterile gloves. Right, we will drape our patient. For the purpose of this demonstration, I have to lift her up, but she should be able to lift up. Taking into account our anatomy, we see some erythema to the top of the area, and now we want to take a good look on inside of the vaginal introitus, and we definitely see a bulge on my right side where you have some induration, a central fluctuance, and an area of erythema. So now we are ready to excise, clean the area. In a circular motion, we want to clean, start from the inside and clean all the way around. Next, I will place a 4x4 just in the area to kind of catch drainage. Now we are ready to anesthetize the area. Remember our field block approach. We go around the area, not directly into the abscess, as this will inoculate bacteria into the abscess. We don't want to do that. We want to just provide a field block around the area. Superficial on 3. Take a deep breath for me. 1, 2, 3. And then we're going to inject as we come out. Again. 1, 2, 3. Breathe for me. Aspirate. Inject as we come out. This side. 1, 2, 3. Aspirate. Inject as we come out. And then once again. 1, 2, 3. Aspirate and inject as we come out. We will give our patient about 2 to 5 minutes. And then we are ready to actually lance the area. 5 minutes has passed. Miss Susie, you doing okay? All right, now we want to test to make sure it is nice and numb. I use the end of it and say, how does that feel? Are you feeling anything there? Notice I'm using the back end of the scalpel. She feels nothing, so we are ready to excise. We keep the concept of long and wide. Remember, you need to make a good incision over this abscess. So, long, let's punch her. And wide, straight across that abscess. Okay. Now, we start to squeeze, and we can see some gooey stuff coming out. So gratifying. And again, we give it that a squeeze. Now let's use our culture at this point to go ahead and grab our culture swab. We want to go ahead and put that into that area and get us a good culture swab. Now, just know that it can get a little messy. We'll take our curved hemostats. And now is that time to really break up those inoculations. Just know this can be painful, but you definitely want to get into that abscess cavity and break up anything that's left. Not to go too deep, because you definitely do not want to puncture through the back of the abscess wall and cause excessive bleeding. Once we break up those inoculations, we want to squeeze again and make sure we have gotten all the stuff. And as you can see, we got a little more to come out. Now, this is the time where we use either the ward catheter or we actually use packing. Today we have packing. So we'll take a Q-tip. You want to open your packing. If you notice the packing, it gives you an inch, so we have 1/4 inch We have 5 yards, and this is plain packing. And just notice what's on the inside of the bottle is sterile, so try your best not to go into the bottle or contaminate the bottle. You want to spread open if you can, and then just take the end of that packing and pack it right into that abscess. If you have a family member there, this is the time to ask the family member to come in and get packing teaching if the patient is not able to perform theirself. We have put, you want to stick to about a 1/2 inch, no more than 1 inch, because remember, we're not trying to overpack. We're just kind of creating a area that facilitates for drainage versus packing the wound. We don't want to cause tension, which leads to tissue ischemia. You want to cut it where there is a clear, at least 1 inch, maybe 2 inches from the outside, so that it's clear when the patient is wiping and placing that maxi pad that the packing is still in place. Remember, we talked to you about the packing on the inside is sterile, so you just want to close this up and remind the family member that this has to be cut off during the next time it is due for packing. Now, you simply place a gauze there and then add your maxi pad, and you just tell them to wear good fitting underwear so that it secures it in place. They don't need anything more than that. And just be mindful, this is extremely painful. So pain medicine for a few days, a little something more than maybe ibuprofen or Tylenol may be helpful for most patients. If patients has a good pain tolerance, they may be okay, but you definitely don't want a million calls on Monday about pain. All right, that ends the demonstration today. Please feel free to give us your feedback. Thank you.
Hey, thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.